The summary of absorption in different parts of digestive system. Mouth. Certain drugs coming in contact with the mucosa of mouth and lower side of the tongue are absorbed into the blood capillaries lining them. Stomach. Absorption of water, simple sugars and alcohol etc. takes place. Small intestine, principal organ for absorption of nutrients. The digestion is completed here and the final products of digestion such as glucose, fructose, fatty acids, glycerol and amino acids are absorbed through the mucosa into the bloodstream and lymph. Large intestine, absorption of water, some minerals and drugs takes place. The absorbed substances finally reach the tissues which utilize them for their activities. This process is called assimilation. The digestive waste solidified into coherent feces in the rectum initiate a neural reflex causing an urge or desire for its removal. The ejection of feces to the outside through the anal opening, defecation, is a voluntary process and is carried out by a mass peristaltic movement. Disorders of digestive system. The inflammation of the intestinal tract is the most common ailment due to bacterial or viral infections. The infections are also caused by the parasites of the intestine like tapeworm, roundworm, threadworm, hookworm, pinworm, etc. Jaundice. The liver is affected, skin and eyes turn yellow due to the deposit of bile pigments. Vomiting. It is the ejection of stomach contents through the mouth. This reflex action is controlled by the vomit center in the medulla. A feeling of nausea precedes vomiting. Diarrhea. The abnormal frequency of bowel movement and increased liquidity of the fecal discharge is known as diarrhea. It reduces the absorption of food. Constipation. In constipation, the feces are retained with the colon as the bowel movements occur irregularly. Indigestion. In this condition, the food is not properly digested, leading to a feeling of fullness. The causes of indigestion are inadequate enzyme secretion, anxiety, food poisoning, overeating and spicy food. PEM. Dietary deficiencies of proteins and total food calories are widespread in many underdeveloped countries of South and Southeast Asia, South America and West and Central Africa. Protein energy malnutrition (PEM) may affect large sections of the population during drought, famine and political turmoil. This happened in Bangladesh during the Liberation War and in Ethiopia during the severe drought in mid-80s. PEM affects infants and children to produce marasmus and kwashiorkor. Marasmus is produced by a simultaneous deficiency of proteins and calories. It is found in infants less than a year in age. If mother's milk is replaced too early by other foods which are poor in both proteins and caloric value, this often happens if the mother has second pregnancy or childbirth when the older infant is still too young. In marasmus, protein deficiency impairs growth and replacement of tissue proteins, extreme emaciation of the body and thinning of limbs results. The skin becomes dry, thin and wrinkled. Growth rate and body weight decline considerably. Even growth and development of brain and mental faculties are impaired. Kwashiorkor is produced by protein deficiency and accompanied by calorie deficiency. It results from the replacement of mother's milk by a high calorie, low protein diet in a child more than 1 year in age. Like marasmus quashiorkor shows wasting of muscles, thinning of limbs, failure of growth, and brain development. But unlike marasmus, some fat is still left under the skin. Moreover, extensive and swelling of body parts are seen.